Dear ladies and gentlemen, dear student, let me introduce this lecture on topic public health as a science, and second part it is the social factors for the health. So, according definition of WHO, health is a state of complete physical, mental, and social well-being, and it's not merely or absence of disease, of infirmity. So, soundness of the body-mind, that condition in which its functions are duly and efficiently exchanged. It is according Oxford English Dictionary, and it means also the level of functional and or metabolic efficiency of living organisms. In humans, it's mean in general condition of a person, mind, person's body. Usually, it's meant to be free from illness, from any types of injury or any types of pain, as it's good health or healthy. It is according Webster Dictionary, and we can find in internet more and more sources where we can find the definition of health, and it will be absolutely different. So, second, public health, it is a science and art of prevent of all diseases, prolonged life and promotion healthy lifestyle through organization efforts and informed choices of society organizations, public and private. And also it is will divide to communities and individuals. It is according to Winslow a definition which he said in 1920. And also it can be like a combination of scientific disciplines and skills and strategies what are directed to the maintenance and improvement of the health of the people. So early public health intervention, it also start from early centuries, many centuries ago. And first well-known studies, it was ancient medicine, ancient Indian medicine with very ancient roots. It's also well-known Ayurvedic system, and founder of Ayurvedic system was the greatest founder of Ayurvedic system, Sushruta Samhita. And also after that well-known system of medicine was ancient Chinese medicine. And also here was a variation to prevent smallpox, and also was a wild using of acupuncture, and also Egyptian medicine. First experience of using drugs, description of diseases. They tried to consist a list of all well-known diseases in that time. Planet cities. They choose the place for cities, not accidentally, but according some specific methodic. Also using before Roman, they used a public bath, and also underground drains, used the water from underground drains. Next, it is a Greek medicine. Greek medicine, well known, it is Aesculapius and also Hippocrates. And then after this, next step was Roman medicine. Roman medicine founder was a Galen. Next, after first steps in medicine was a Middle Age. Middle Age well known by the quarantine, isolation of ships, and also burning corpses, houses, cities. It was a trying to prevent diseases, throwing out ill people from the villages, cities or towns. And also well known in Middle Age was an Arabic medicine. Main representatives and main founders, it was Abu Bakr, Ibn Sina, and also main areas of study, it was pharmacology, alchemist and hygiene. Renaissance and globalization bring to the West Europe so well-known names like Paracels, André Vesali, Ambroise, Payer, William Harvey, and all others teachers and founders of medicine in West Europe. And sanitary awakening. Sanitary awakening was conducted by these well-known names like Chadwick, Snow, Simon, Pasteur, and others. And like a final step was already age of modern medicine. Modern medicine include and start from these names like Pettenkofer, McMahon, and Pew, X-ray, vaccines, antibiotics, Virchow, and Newman. So, and medical revolution, it's mean when was founded, what all bodies, all structures in our world consist from atom, and also human body also consists from atoms. Atoms, it is a structural element of molecules. Molecules, it is also can be included in these micromolecules. Micromolecules consist, it is a main component of organelles. Organelles, cells, consist from different types of organelles. Tissues consist from the cells. Organs and organ systems consist from organs, tissues, and cells. And all human body consists from all these structures, level structures. And in 20th century was conducted healthcare revolution. Healthcare revolution, it's been about try to understand it. Health like a condition, not only individual. Here you can see first level of health, it is individual, but only trying to understand health like a common condition, like a public health. And also second level after health of individual will be level of health of little group or health of group. Third level after second level will be health of all population. All population, it's mean peoples who live in local area. Local area, for example, it can be town, village, city, or maybe country. And level 4, it is highest level in public health. What we understand, it is a health of society, health of population of all country, of all continent, all part of the world, all common world, and can understand it like a population as one common world. And also have some specific question: how we need to measure our health? We need to measure it like an individual definition and understanding, or must we measure it like a common population? And and second question, very strong question, it is when we need to measure it. We need to measure on the stage of receiving care, when already ill patient will go to the ambulatory, to the ambulance, before awaiting care, when he already ill, he already need in care, but he not have conditions what will be with a bad prognosis for his future life, and for maybe for some bad outcomes of this disease. And also underwater, this part of iceberg, it is ill but not seeking help, and or we need to measure it at health stage, when our patient, it is not yet doesn't know about future ill or sick. So what is disease? Disease, it is a particular, abnormal, pathological condition what we can affect like a part of all organism, and also it can be a dysfunction of organism, human body, and under disease we often can understand what the disease. It is not so strict understanding. It's more broadly to refer any condition what can cause the pain. Not only traumas, not only injuries, or not only infectional disease or not infectional. It will be like a common understanding of this. So it was ancient understanding of concept of causation. First understanding, it was like evil spirit. Second theory, it is like a germ theory, what microbes, from microbiology point of view. And right now, like we understand in our modern time, in certain time, it is like will be web of causation. It consists of from many factors, and also understanding like epidemiological triad. It is like a infection agent. It is like environmental exposure, and it is like a host susceptibility. So, what's the risk factors? Like an attribute of exposures, it's significantly associated with the development of disease. A determinant can be modified by intervention, thereby reducing of possibility of occurrence of disease or other specified outcomes. So, the presence of risk factors does not imply what the disease will occur, and the absence what the disease will not occur. It is what we need to remember. And it is also divided by factors. Main group of factors, it is a socio-economic factors. It is like a working condition, like a condition, house condition or place where we live, a material well-being, a level and the quality of food or meal, rest and other. Social biological factors. It is divided by age, by sex or gender, predisposition of hereditary diseases and others. Third group, it is ecological and natural climatic factors. Pollution of inhabitancy, mid-annual temperature, presence of extreme climatic factors and others. And group number 4, it is organizational or medical factors. Security of the population, medical aid, quality of medical aid or medical care, and availability to help for our population. Susceptible groups, as we already said, can divide it by age, by socio-economic status, by pre-existing morbidity, what already have, and divided by specific treatment. Social determinants of health can be divided to the closest or main factors, and from another not so important but also important for us, like a specialist in public health. This it's mean families. It's around. It will be about heredity or about genes. Communities. It will be more specified for a communicable disease. Societies. It also near with communities and societies. And also individual health. Individual health, like you know, according to definition of WHO, from a 50%, our health. Our individual health depends from us, depends from our healthy lifestyle. This is a basic indicators of health, which we are using usually in public health and this, like a science. And it's mean social demographic indicators. Second, main and very important indicator of health of the population. It is rate of morbidity, rate or numbers of of persons with a physical inability, numbers of traumatism, and it is indicators of physical development. Most important in this type, it is children physical development, and also indicators which recommended for us by WHO. It is a deduction of GDP on public health services, also like a common, and also divided in per capita availability of primary medical social helps, coverage of population by medical aid, level of immunization of the population, degree of inspection of pregnant women qualified personnel, food condition including food of children food, or level of children death rate, average duration of forthcoming life or life expectancy, and hygienic literacy of the population. Have the good sources where our population can find information about hygienic condition, how they can prevent of some disease, and also medical demographic indicators, morbidity indicators, number of people with a physical inability, and also indicators of physical development of the population. So, thank you for your attention.